Hi all. So we're continuing our discussion on the neurobiology of depression. And so for this little video, we're going to talk about different ways of studying what's going on in the brain, different ways or different types of studies that you can conduct. The first thing I want to point out is that for a lot of this class, we're going to be talking about a lot of the areas from the limbic system. So I would really encourage you all to go review the limbic system, what areas are involved in the limbic system, and what they do. We'll be talking about them all, but I kind of will be assuming that you're familiar with the limbic system and the different parts of the limbic system. So there's a nice image on this slide that's pointing out some of the areas involved in the limbic system. Obviously, depending on who you talk to, they might refer to different parts of the brain as the limbic system, but there are definitely some very common ones. So the most common or largest areas we'll talk about will be the thalamus, the hypothalamus, and the amygdala. But all these other areas will also be very important to us. So let's get into how we can assess neurobiological changes. So when studying different psychological disorders, what we want to do is study the changes in the brain, because if you just look at a brain, how are you supposed to know what's wrong with it unless you have something to compare it to? So that's why we are looking at changes. Sometimes this will be by having a control group of healthy individuals, and then a patient group. Sometimes it'll be an ABA type format where you have, say, an animal that doesn't have any symptoms or disorders, so a healthy subject, and then you'll do some kind of manipulation to change, to induce a disorder or some symptoms of one of these disorders, and then you'll look at how does the brain change. So the ones we're going to talk about today are lesion deficit studies. These are very big, definitely more popular in animal studies than humans for obvious reasons. Then there's structural imaging, so that's structural MRIs and DTIs. Again, these are all things you should have learned about in Psych 104 and other classes, so we'll talk about them, but then also I want you guys to, if you have questions, look back at your notes from 104, and really refamiliarize yourself with these, because we're going to be talking about them all term. And then, of course, there's functional imaging as well, so fMRIs, PETs, and SPECT. So, with lesion deficit disorders, like I said, this is definitely more popular in animals because you can, obviously ethical reasons, but there are a lot of case studies that we can look at with lesions in humans. So the most famous one would be Phineas Gage. It's really my favorite thing to talk about. He was a railroad worker who was working, and there was an accident, and he got a pipe through the skull. He survived, but his behavior changed a lot. It did go up. The pipe went through his left frontal lobe, and one of the main things they noticed was a real change in his personality. So you can see how these lesion studies, because he lost part of his brain, you can look at how does someone change before and after losing that part of the brain. Of course, you can also think about HM when looking at lesion deficit studies. But in animals, then we can more accurately control this and search for a desired behavior or desired symptomology based on what part of the brain we remove. Great. So there are structural differences in MDD specifically that we're going to talk about. So there has been lesion deficit studies associated with secondary depression, so people that, experience a loss of the frontal lobe, temporal lobe, or basal ganglia will develop MDD after. So there is some suggestion that there's something happening in these areas that helps regulate mood and emotion. We can then do studies using animals by removing these areas and see, do these animals then exhibit these depressive symptoms? Again, we'll talk about that later. There's then structural imaging by MRI. So this is where what they'll do is they'll have healthy patients and then patients with MDD, and they'll compare the structural MRI of these patients and actually measure the volume of all the different brain areas. Again, usually in that limbic system, but also all other areas of the brain, and then compare the volumes. So we actually see a decrease in the volume of the hippocampus, the anterior cingulate cortex, the caudate nucleus, the putamen, and the orbitofrontal cortex in patients with MDD. Of course, something else is that, again, we talked about how MDD can kind of be a secondary instance for people that have other diseases or something else going on. So, for instance, with stroke, Alzheimer's, Parkinson's, there's a high comorbidity. And these different types of things like stroke and Alzheimer's, they themselves also, you can see a decrease in volume of certain brain areas. So it's really hard to kind of figure out, is that decrease due to Alzheimer's or MDD, or did that decrease in a particular area lead to MDD, that kind of thing. So there's a high variability in structural differences across all these different things going on. We do see that the volumetric differences are a lot older or different, or a lot worse in older patients. So in younger patients with MDD, you don't tend to see as big of a difference in these structural areas from a healthy patient. But as you get older, these differences get bigger. Which is interesting because depression does affect younger patients more than older patients. So that might be something that's going on. Then if we look at functional brain imaging, so with functional brain imaging, then there's positron emission tomography. Some of the studies we'll talk about will use this. So I just want to bring up what these are. So PET, or PET, so it uses positron emitting radio tracers to analyze brain metabolism. So pretty much how is the brain working, what part of the brain is using up more glucose or more energy during a different activity. So if the brain's using more glucose, it's more active in that spot than in a different spot. And then the other one that we're going to talk about throughout the course probably will be single photon emission computed tomography. And so this measures brain blood flow. So this is measuring how blood flows from one area to the other and how effectively it does that. And it uses radio tracers to do this. So tissue uptake of this gamma emitting radio tracer is proportional to blood flow, and like an increase in glucose means more activity, then more blood flow also indicates more activity. So that's how these function. So how can we use these then to further understand neuropsychological deficits? So what we'll look at is kind of using this at the same time as looking at some structural imaging, because structural imaging can fail to show consistent changes in MDD, whereas functional imaging techniques allow us to investigate changes in neural activity or connectivity. So not just brain areas, but how does the brain connect to each other? Are we getting changes in the connections itself? So it's more of a real-time thing, and we can understand what's going on maybe day to day or week to week, rather than having to wait years to see what the difference is in brain volume. And we can also use these functional imaging and correlate it with behavioral tasks. So we can really understand, are there different behaviors that are correlated with this neural activity or stuff like that. So PET imaging of depression in Parkinson's. That's what this image shows. So on the top, you have a non-depressed patient, and then on the bottom, you have a depressed patient. Both of them do have Parkinson's disease. And what you can really see is that decrease in activity, or that decrease in the glucose absorption in the Parkinson's depressed patients on the bottom compared to the patient on top. So you see less of that bright yellow red in those frontal lobe areas. So now this is a SPEC image. So that's the second imaging type I was talking about. Again, this one's looking at blood flow. And so on the left, you have a depressed patient. On the right, you have a non-depressed patient. And again, we see less activity or less blood flow in this area that's circled in red here that I'm going to show you with my mouse, compared to the non-depressed patient. So there is some red, a little bit of white, which is the extreme, but you do see less compared, and this is after a stroke. So again, we're looking at that comorbidity with depressed and non-depressed patients. And then this one is looking at regions of increased and decreased cerebral blood flow in depressed relative to control. So pretty much we're just looking at how does blood flow change in the amygdala. We've got the thalamus, in different brain areas with depressed patients versus non-depressed patients. And so this is the colors indicate the change. So the 0 would be no change, and so the brighter the color, the more change there is between the non-depressed and depressed individuals. So really, this was just to show, that we can use functional imaging studies, very popular in human studies, but we can also use it sometimes in some animal studies as well. And functional imaging studies are commonly observed increases in activity in depression. So you get more activity in the frontal, the orbital, the parahippocampal cortices. There's more, again, in that the prefrontal cortex, and part of the cingulate cortexes. You definitely seem to see more, sometimes in the amygdala, sometimes not, but definitely more in that hypothalamus, which we know plays a role with the endocrine system. But then we also see commonly decreased activity of depression of the dorsal medial prefrontal cortex, the dorsal anterior cingulate cortex, and the posterior cingulate cortex. So you really need, within just the cingulate cortex, different parts of this that cortex is known to be decreased in depression, while the subgenual cingulate cortex, I'm not great at pronunciation, guys, is known to have an increase in depression. So that's very interesting that even within that cingulate cortex, different areas react differently to depression. So that's really all I wanted to talk about with this. The next couple videos will be different theories of depression, so look forward to that.